Hi, I'm Stefan. I'll be doing a head-to-toe assessment, and so first I am going to be checking the patient's chart and seeing if there's anything that I should be looking for, any limitations that the patient has, and if it's okay, then I'll be able to go into the room. So first, before I enter the room, I'm going to do some hand hygiene. Knock, step into the room, introduce myself to the patient. Hi, Mr. Sam Diego. I'm Nurse Delano, and I am going to be doing a assessment, head-to-toe assessment. Is that going to be okay? And once it gives me a verbal yes, then I can go to my assessment. But first, I'm going to be checking for identifiers. First, I'm going to be doing a 1-minute safety check, and I've noticed that the side rail is down, so I'm going to put that up first. Okay, so now that's up, now I'm going to be doing a identifier. So, Mr. San Diego, can you please state your name and your birthday? Okay, good. Can you tell me who the president is and what today is? Good. Can you tell me where you're at? Okay. And can you tell me why are you here at the hospital? Okay. Good. Thank you. So after that, I'm going to be first checking the head. So I'm going to be first. First I'm going to be raising the bed so that it's a very comfortable height up to my waist. Okay, so for that I can put the safety rail down, and then I'm going to be looking at this head, and I'm going to be checking any for skin. Obviously this entire assessment I'll be checking for skin integrity. So while I'm doing the assessment, so first his head, I'll be checking if there's any like ulcers or any skin breakdown. Be checking the back of his head. I'll be checking the bony prominences. I'm going to be also checking his hair if there's any like nits or something wrong with his hair. Okay, so looks so good. And then I'm going to be checking his eyes. So first I'm going to be checking his eyes. So I'm going to come inside here, come here, and what I'm looking for is perla, if the pupils are even, if they are reactive to light, and also if they're even, if they're consensual. Okay, it's in the middle. Then I'm going to be doing accommodation. So Mr. Diego, can you look at the wall over there? Okay. Now can you look at my pen? Good. Can you do it again? Look at the wall. And can you look at my pen? Good. And everything looks good. So then after I do that, I'm going to be checking his nose. So underneath his nose, I'm going to be looking if there's any skin breakdown. So Mr. Diego, can you blow out? Good. Can you blow out on this side? Good. I'm going to also be checking if there's any patency, any impaction, or anything that's wrong, any breathing problems with his nose. And then I'm going to be doing the ears. Good. I'm obviously going to go on the other side and be doing that. So what I'm going to be doing on the ears, I'm going to be looking for if there's any impaction of like earwax and anything skin breakdown. I'm also going to be looking behind the ears to see if there's any skin breakdown, if he's wearing also like any nasal cannulas. So after I do that, I'm also going to be checking his mouth. So what I'm looking for in his mouth, if there's any sores, any thrush, if there's any cavities, if the tongue is midline. Also, I'm going to be checking if there is any sores inside his mouth. And also, what I'm going to be asking him now is, Mr. San Diego, can you please smile? Okay, good, thank you. So I'm going to also be checking for facial symmetry if he's any dysphagic or anything like that. Now I'm going to be checking his neck. So in his neck, I'm going to be checking his if there's any JVD, any distension, and then after that, I will be checking his carotid artery first. Good. And I don't want to do both sides because I'm obviously gonna obstruct the flow of his blood and he's gonna pass out, and I don't want that. Okay. Good. Then also I'm going to ask him to swallow so that I can see that he is being able to aspirate and as well. So Mr. Diego, can you please swallow for me? And as soon as I see his trach move, then I can see that he's swallowing correctly. Then after that, I'm going to be asking him to please hold my hand for grip strength and good. And then I'm going to ask him to please push on my, like, I'm going to hold my hand down and ask him to pull to go up. Okay, Mr. Diego, can you push down? Good, everything looks good. And then I'm going to be also doing his cap refill. Okay, so what I'm looking for, if it's the blood comes in for within 3 seconds. So that'd be good. So also, I'm also going to be checking for any edema, obviously, anything throughout this assessment if there's any edema. So first, I'm also going to be heading down and I'm going to be checking the chest first. So Mr. Diego, I need to go also hear your heart and hear your breathing. So it's okay if I can do that? And obviously, he says yes. So, okay. So, okay. I'm going to check be checking his heart first. So what I'm going to do is going to see his aortic, which is the second intercostal. And then across is the pulmonic, also at a second intercostal. And then it's going to be down one, third, which is the Erb's point. And then I'm going to go one intercostal down to the tricuspid. And then I'm going to go down to the mitral, the PMI. And fifth intercostal mid-clavicular. So I'm going to be listening for any love dub, if there's any arrhythmias, irregularities. I'm going to be listening for a whole minute on his apical, like PMI. So I'm also going to be checking if there's any, I'm going to be looking for the love dub, any irregularities, arrhythmias. Everything looks good. Okay. So then also I'm going to be checking his lungs next. Oh, before that, I'm going to want to check his radial pulses. Good. And I want to check his brachial pulse and see if there's any difference between his apical pulse and his radial pulses and see if there's any blockages. So now I'm going to do auscultate his lungs. So I'm going to be starting here at his between the clavicle and it's the supraclavicular. So up here, and then up here, and go down, then down, then down. So I'm going to be looking if there's any adventitious sounds, if there's any rails, any wheezing, any crackles, anything that seems abnormal that I could hear. I'm also going to be seeing his breath, if it's shallow or if it's very deep, and see if there's any labored or unlabored. So next, I'm also going to be doing, so I'm going to be checking his bowels. So what I'm going to be doing first is I'm going to inspect. Okay, Mr. Diego, I'm going to be looking at your bowels. When was the last time you had a bowel movement? Okay, good. When was that? Actually, when was the last time that you voided? Okay, good. So I'm going to make sure that he is voiding right and he's having normal bowel movements throughout the day. So I'm going to be expecting his abdomen. So to see if there's any distension. Looks like it's okay. So then I'm going to be auscultating first. So I'm going to start in the lower right quadrant and go up to the upper right quadrant, then to the upper left quadrant, and then to the lower left quadrant. And then so I'll be listening for 5 to 20 seconds for any sounds, and if it's okay. If I don't hear any sounds, then I should be trying to hear any sounds for 5 minutes or more. So after that, I'm going to look for any distensions on his liver. Okay. Everything looks good. Okay, now I'm going to palpate his abdomen. So Mr. Diego, tell me if this hurts. Good. 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 I was going to ask did you feel any pain? Okay. Obviously he said no. So everything looks good. So then I'm going to be asking him if there's anything wrong with his genital areas, if he's having any problems with it. So Mr. Diego, do you have anything wrong with your genital areas? No? Okay, sounds good. So then he says no, then I don't have to look. It'll be okay. Oh, also, for lungs, I'm also supposed to check his back after I did that. So I was check his lungs on his posterior side. So before I forget that. So after that, I'm going to be checking his legs. Okay. Look for any skin breakdowns. So Mr. Diego, okay, I'm gonna be looking at his legs, looking for any edema, looking for any skin breakdown, obviously, as well. So I'm gonna be checking his pulses first, his pedal pulse, dorsalis, pedis dorsalis, and then I'm gonna be checking both sides. And then I'm going to be checking his posterior tibialis on the anterior side. Okay, good. And also going to be checking his cap refills. Good, good. Okay. Mr. Diego, can you please push on my hand? Good. Can you please don't let me push? Good. Can you lift up your leg? Good. Can you please pull down your leg and don't let me? Good. Okay, good. I'm also going to be checking for his skin integrity, especially behind his heels because of the bony prominence. Okay, good, good. Okay. So obviously also if I can't hear his radial pulses, then obviously I'm gonna go up and see his popliteal, and if I go up more to his femorals. So if I can't feel anything on his dorsalis pedal. So good. Okay, Mr. Diego. Looks like everything's good. Okay, put this back on you. Also going to be checking his bony prominences on his back. So, Mr. Diego, can you please go forward?
Oh God.
Oh, thank you, nurse. Okay, I'll be looking for any skin breakdown, if any, on his bony prominences, on his sacrum. Okay, good. And also, if he's any soiled, then I would recommend that he would get a bath or anything like that. Okay, you look like you're clean, Mr. Diego. Huh. Okay, so Mr. Diego, I'm gonna give you your call light. Everything looks good. I'm gonna lower the bed. Is there anything you like, Mr. Diego? Oh, everything sounds good, man. Okay, now I'm going to be doing my 1-minute safety check. Good. Hand hygiene. Then go outside. And then I'm going to document.